the culprits we think about are not the culprits. What is the core uh problem? What is the core root cause of all these different metabolic outcomes: diabetes, obesity, hypertension, fatty liver disease, and of course, moving downstream to heart attacks and strokes.
Yeah, and cancer, Alzheimer's, mental illness, I would put those in the same bucket as manifestations of an underlying fundamental root cause disease. And as you say, that is metabolic disease. Well, what does that mean? It's disordered metabolism that, Gerald Raven famously began researching at Stanford in the last century, a little bit about it, but it's a combination of insulin resistance, which manifests as type 2 diabetes, but it also manifests as many other things. Inflammation, which is a prime driver of all these chronic diseases and aging, and also oxidation. And today, if you look at the criteria for metabolic disease, simple things like your waist, your blood pressure, your glucose levels, and your triglycerides or your HDL, fully by several studies now, up to 90% of adults have at least one marker for metabolic disease. And we know today that most adults have at least one of these chronic diseases, and many have many of these diseases. So it's widespread throughout our environment. But the thing that really the wake up call for me was, and what I think you're getting at, is that I used to think of these as being separate diseases.
Mhm.
Basically obesity and cancer. They're really different. Well, actually, obesity today is now replacing tobacco, on the road to replace tobacco is the number one environmental risk factor for cancer. Just being obese,
Mhm.
it's going to be worse than smoking cigarettes now. So, and even
Mhm.
mental illness and Alzheimer's disease. So what does that mean? Well, there are certain things we can do that really a doctor can't do. I'm a doctor, but I know that doctors don't make me healthy. They just make me less sick. If I want to be
Mhm.
healthy, I need to change my lifestyle. And the lifestyle for most of us is going to be more powerful than any pills or surgery that we're given in our lifetime. The lifestyle is really at the root of it. But the fascinating thing is the same lifestyle approaches that will benefit me
Mhm.
for reducing my risk of type 2 diabetes will also reduce my risk for mental illness and for Alzheimer's disease and for cancer, and the same types of dietary tweaks that we talk about in the book, things like uh, removing carbohydrates and going on a ketogenic diet. Well, that same ketogenic diet, people like Chris Palmer and Georgia Ede have shown that can reverse schizophrenia and other mental illness and get people off meds and out of the hospital. Not everybody, but some patients,
Mhm.
it's life transforming. Similarly with Alzheimer's disease, a simple lifestyle like that diet can transform. Again, not all patients, but some patients, they're like night and day. And that's true for now. We're seeing the effect on cancer. We're seeing the effect on certainly high blood pressure and cardiovascular disease, of course, and diabetes and all these things. The other thing that
Mhm.
this book really
Mhm.
woke me up to,
Mhm.
and that many of my colleagues are still not aware of, is that I used to think as a doctor that, these diseases, it's kind of, they're binary. Either you have diabetes or you don't. If you do, God, too bad, we'll help you. If you don't, God bless you. You dodged a bullet.
Mhm.
And similarly, Alzheimer's disease. It's, oh, you got the diagnosis. Well, I now believe, and the evidence is pretty strong, and we talk about this in the book, that these diseases, although the medical profession is set up to kind of either diagnose it, either you have it or you don't, they actually don't begin, the Alzheimer's doesn't begin the moment the doctor tells me, you know what, you did forget your keys, and guess what, you've got Alzheimer's. And
Mhm.
I'm not making light of any of these diseases,
Right.
but I'm
Yeah.
you know and similarly, when you have type 2 diabetes, it's not like you didn't have it a
Right.
week ago
Right.
or even a year ago. or even decades, because all of these diseases, all of the ones we're talking about, these chronic diseases, I believe start years to decades, literally, before the doctor diagnoses them. And if I wait until the doctor calls me into her office or his office and say, "Oh, you've got this particular one of these diseases," I've missed a tremendous opportunity for prevention. What is prevention? It's the lifestyle. It's these same lifestyle
Yeah.
techniques. Like, don't wait until,
Right.
my
Right.
my my heart attack to start,
Right.
living healthy.
Right.